Thank you, Keyshawn, for your coverage of UHDDS. My name is Julie, and I will be going over the Electronic Data Interchange, EDI. The definition in the book that's given for EDI is the Electronic Data Interchange is a standard transmission format using strings of data for business information communicated among the computer systems of independent organizations. EDI is part of a healthcare informatics standard that provides an understandable language to other healthcare facilities to enable the exchange of data. A little history and governance on EDI. EDI was developed in 1979 by the Accredited Standards Committee, who was chartered by the American National Standards Institute, ANSI. EDI is maintained by ASCX 12, and in recent years the term EDI has often been replaced by the term e-commerce. To give some purposes and functions of EDI. EDI is the transfer of information from one computer to another of incoming and outgoing data. EDI uses common language among different healthcare facilities who have agreed to exchange data electronically. And the different healthcare facilities could include the payers, government agencies, financial institutions, employer groups, healthcare providers, suppliers, and can also include some of the claims processors. With the electronic exchange of data, there is a substantial reduction in the handling and processing time. EDI has become a standardized method for formatted information to be communicated and shared with the various facilities. And as we know, there can be many inefficiencies with the handling of paper documents. But with the use of EDI, it has cut down some of that time, handling and processing time substantially. Structure and components of EDI. EDI is included in the syntax classifications, and syntax is a term that refers to the comparable structure or format of data, usually when the data is being transferred from one system to another. EDI supplied specifications of format for which the data will be exchanged. The Content Exchange Standard supplies the specifications of the format that will be used for the data when the data is exchanged from one system to another. WEDI is the Workforce of Electronic Data Exchange, which has been involved in developing the standards for billing transactions in both private and the public sector. Some of the stakeholders for WEDI include physicians, hospitals, health plans, and laboratories, among other facilities. This concludes my portion of the presentation today, and now I turn it over to Tiffany, who will be covering DEEDS, which is the data elements for emergency department systems. Thank you.